Hello dear patients. Today we are going to review the case of foreskin reddening. A young 27-year-old man came to us. He had regular reddening of foreskin, you can see it on the picture. On the glans penis there are focuses of reddening. He regularly went to dermatovenerologic dispensary and there they set him a diagnosis of candidosis and they prescribed him ointments like clotrimazol and other antifungal ointments. Then he was prescribed hormonal ointments, which, if they helped him for a very short period of time. In about 2 days after using hormonal ointments, everything returned. He did not do any analysis because it was not recommended to him there. For about 2 years he had been bothered by this problem and it worries him. What needs to be done in this case? Indeed, it's necessary to do analysis for fungi that are suspected by doctors from dermatovenerologic dispensary. I will remind you that this is a PCR analysis for 8 fungi of Candida. This is a culture test for Candida fungi. Also, this is a culture test for bacteria from glans penis and from this area of foreskin, as well as analysis for sexually transmitted infections. As a result of this study, it was found out that there are no fungi in culture test and no fungi in PCR analysis. Then we found a growth of enterococcal bacteria. It was in small concentration, by the way. Common staphylococcus was present and enterococcus was in 10 to 3rd power concentration. Realistically speaking, it is unlikely that enterococcus in such low concentration could induce inflammation. We took blood analysis for allergy and for sugar. We found an increase of sugar level. So the patient had analysis from endocrinologist and the beginning of diabetes mellitus was found, in spite of the young age. So a correction was prescribed. Can we recommend something from dermatologic point of view? It's no doubt that we can and we should recommend something, as enterococci and other bacteria multiply secondary to an increased sugar level. So it's important that endocrinologist would intervene into this situation with a sexual organ. Secondly, we can and we should correct such things, and we also found enterococcus in the canal, particularly in urethra. Also, we found about 12 to 15 leukocytes, meaning a weak urethritis induced not by sexually transmitted infections but by enterococcus. It was treated. However, in our particular case, this depends more on diabetes mellitus. This allowed to correct the sugar level and to allow the treatment of endocrinologist, and the main thing is that this allowed to avoid relapse, as an increased level of sugar induces multiplication of different bacteria and maybe even Candida fungi. So remember that during a torpid weak course an examination is required and not only an application of hormonal ointments, which roughly speaking have vasoconstrictive action. They remove inflammation but they do not remove the cause, which often leads to such reddening of glans penis and foreskin as in our case. If it's necessary to diagnose and treat different lesions in the area of sexual organs, skin, you can consult dermatologists and venerologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such lesions. We are waiting for you in our clinic